Well, the number of COVID-19 cases continues to be a cause for concern. There are currently over 124,000 active COVID-19 cases and a rapidly rising death toll. So to find out what we can expect during the first phase of COVID-19 vaccinations, we're joined now by Professor Koleka Mlisana from the National Health Laboratory Services. Prof, thank you so much for your time. We'll get into the vaccines and the rollout in just a moment. But what I noticed from your presentation last night is that it was quite important for you, as well as the minister, to address misinformation in the country, because there is skepticism, there are fears among South Africans around whether the vaccine is effective, healthy or not, and that was a priority for you to address.
Yes, that's correct. Thanks, Tumelo, and good morning to everybody. It's actually very important because, I mean, even if government can do whatever it can in their power in hands to bring the best vaccines, if people do not take the vaccines, that's not gonna, will have no impact whatsoever, on the pandemic. And therefore, it's important for us to actually walk the communities, walk the nation through, for them to understand, the safety that goes into vaccine preparation and trials, and also to try and demystify all these theories and stories that are coming around, so that people can gain confidence and know that the product that is being brought to them, it is actually a safe product. And so we really want to stress that. We want to stress this to South Africans, that really everything that you are hearing, whether it's whatever media, check it first, find the correct resources and sources of information. Otherwise, then all our efforts are going to be going in vain and will have no impact whatsoever.
Yeah, you addressed the issue there just in terms of misinformation on 5G, people thinking that, somehow the virus can be transmitted through 5G. You addressed the issue around microchips. There's a lot of controversy around whether people will be traced through this vaccine. I know that you did this last night, but for those who probably even missed it, can you just take us through some of those myths that are lies, that are false, and then also reiterate the healthy or the safety of these vaccinations or these vaccines?
Okay. I think one of the important things is that people need to actually realize that all these myths, they truly are what they are. They are myths, it's just misinformation. And if you're looking, for instance, I was saying last night, there is no way, and we know that for a fact, that viruses cannot travel on radio waves or mobile networks. It's impractical. It's not possible. And so you cannot get 5G spreading COVID-19. And the other important thing is that we need to realize, people are thinking that this is a way of trying to decimate, the populations in Africa or in poorly resourced countries. But if you're looking at the infections, you look at the number of cases, there are a lot more cases in US, in Europe, and everywhere else compared to Africa. And even number of deaths are way more in the West than in Africa. Coming to the vaccine safety, I think, Dr. Pillay last night clearly showed us, how the different kinds of vaccines and how these vaccines are going to be coming in. Firstly, it's a vaccine vial, it's fluid, and therefore, and it's not just one dose. So it's not like a bottle is going to be specifically, for the one person, but you'll get 5 to 10 doses per bottle, and it's fluid, so you cannot put anything in it. So there's no microchip. There is nothing that is going to be tracking people and seeing what they are up to and what is happening. And also, any vaccine that is coming into the country, it goes through this rigorous, search and review by the regulating agency, and each and every, vaccine company has got to declare what are actually the constituents, what is it that vaccine is constituted of. And so we would know. And I really want to say to South Africans, there is no vaccine that has got a chip. There is, the vaccines are safe. We have seen the studies, the trials, and now it's a matter of actually implementing them into the country. And the other advantage that we have, remember the US and other countries have already started vaccinating. And so we already have got more than 70 million people who have actually been vaccinated, who have received at least one dose of vaccination. So we have got all that information and we're able to follow, and we have not seen any issues of concern insofar as adverse events are concerned. So really, this is just to say to South Africans, these vaccines, they're here, we're bringing them in so that they can help us. And as you have said correctly, that obviously the first phase is really going to be looking at vaccinating the healthcare workers because they are in the front line. We want to make sure that we protect our healthcare workers so they are able, in turn, to serve the nation.
And speaking of that first batch, Prof, I mean, how many sort of batches or rather doses are we expecting come the 1st of February? And will it cater for all healthcare workers in the country? Are you sure, are you confident that it will indeed cater for every single healthcare worker in South Africa?
Okay, so there was a brilliant presentation that was given by Dr. Tulare last night. And really, so the first batch that's going to be coming in is estimated to be 1.5 million. Now, our data shows that we have got 1.250 million healthcare workers. 350,000 of those are insured, and about half of that, 170, actually belong to GEMS. So we're looking at 1.25 million healthcare workers. And there's a very extensive plan that government has gone into to make sure that all categories of healthcare workers are going to be catered for. In fact, we saw even the registration that we are expected to do, which is, using the electronic vaccine data system. And so really there's a lot of work that has gone into this, and we are therefore confident that each and every healthcare worker in the country, they must actually register and then they can get vaccinated, and we'll have enough doses to vaccinate everybody.
Prof, thank you so much for your time. We'll leave it there. Professor Koleka, Mlisana.